Okay, Sheila, I got in touch with you today for this interview to mainly talk about your call on Alcohol Action Ireland for references for alcohol to be strongly covered in the new National Drug Strategy. And I listened to your recent interview with Ciara Doherty on News Talk about the topic. Leading us up to talking about the strategy, Sheila, I was struck, I have to say, by your recent interview on News Talk about alcohol and how it is viewed in society in Ireland. Um, Admittedly, I don't really go to pubs anymore, but I was under the impression that while there has probably not been a majority sea change in how alcohol is viewed in Ireland, but there has been a big change in how it is viewed in only the last several years. How do you think things have changed over the last several years, Sheila?
Well, there are positives, and we're always very keen to celebrate the positives. So, if we're to look over the last 7 years since 2018, actually alcohol consumption per head of population has gone down by about 15%. And that's a really, really positive thing. And we would believe that part of that is actually due to the Public Health Alcohol Act. And the reason that we would say that is that we look at other jurisdictions which don't have those sorts of controls, say in advertising or structured separation in shops or minimum pricing, that there is higher alcohol consumption. So if we look to the UK, for example, they wouldn't have seen that same level of decrease. But at the same time, there are still quite significant issues. So if we were to say, for example, looking at the younger age group, the 15 to 24-year-olds, we had seen some improvements there. What we're seeing there is that the average age at which young people are starting to drink has actually gone up. So it used to be at an average of about 15, 16, and now that's gone up to 16, nearly 17. And that's again a very positive thing. But what we're seeing is, though, that when young people do start to drink, they are drinking at high levels, and there would be a high level of binge drinking. And indeed, the proportion of that younger age group who are drinking, that's also gone up. So, if we were to look, kind of comparing from about 2015, 2016, you would have seen there at that stage about 66, about two-thirds of 15, 24-year-olds were drinking. Last year, that had gone up to three-quarters, 75% of that cohort were drinking. So, as with all of these things, it's a bit of a mixed picture. There are positives, we need to celebrate those, but there are definitely concerns, and that's these are things that we're pointing to, and that we're saying that in a new drug strategy, we need to be aware of those issues and to take the action that's needed.
Okay, we're talking again in a minute about how big of a problem alcohol misuse is in Ireland, but just as regards the Public Health Alcohol Act that only came in the last few years, like I personally think that things like structural separation and the restrictions on television. I know a lot of people nowadays don't watch as much television than they used to, but things like the television restrictions and structural separation, I think they have to, maybe over the long term, but make a big difference to the psychology of people. What do you think, Sheila?
Yes, I think one of the things that those measures are trying to do is really essentially to say that alcohol is no ordinary product. It's not the same as buying milk and bread and orange juice or whatever. That alcohol is a different sort of product. It's a harmful product. It's carcinogenic. It's toxic. It's addictive. And by putting something like the structured separation, and putting it in one aisle and behind a barrier, it's a small measure, but it is saying there is a little bit of a difference there, and we hope that actually follows through then in the in years to come, that you'll see some impact from that. And I would say that we are seeing that reduction in alcohol consumption per capita, and that is very, very positive. Where we do have the problems, I think, is that we still, as I say, have very high levels of binge drinking. So that's drinking a lot on one occasion. Across OECD countries, Ireland would be the eighth highest in that, for binge drinking, and indeed that has been going up in the last couple of years. So, as I say, there's been good work done, but we still have a lot more to do.
Yeah, and I know about alcohol. It's always been the case. I think things have improved somewhat, but it's always been the case that a lot of people, even even adults who are like fairly old don't see alcohol as being a drug that's open to
Yeah.
misuse, but what it is really, and so you're calling, like, I understand that alcohol is actually mentioned in the current national drug strategy, but it's not given much mention, isn't it?
Yeah, so that was actually a commentary that would have come, during the evaluation of the last strategy, and there was a publication of that evaluation, and it made that point that many contributors had noted that alcohol didn't perhaps get the attention that it needed to get as part of a national drug strategy. And just to give a couple of examples here, some of the data on this, if we were looking at the number of drug treatment cases, so last year, for example, there had been about 13,300 cases for illegal drugs, which is good. I would be saying we need more of that, and that's a very positive thing. But if you look at how many alcohol treatment cases were there in the same year, it was under 9,000. So it was firstly less than the numbers who were accessing treatment for illegal drugs. But very concerningly, we know that 15% of the population have a problem with alcohol, as in an alcohol use disorder. That's nearly 600,000 people. Not all of those would be at a severe level, but if you were looking even just at those with a severe alcohol problem, it's about 90,000. So if you're saying 90,000 people with a severe alcohol problem, less than 9,000 actually accessing treatment, you'd have to say there's a question mark there. We do have a drug problem in Ireland, and in fact, actually, our drug problem is very associated with our alcohol problem as well. But somehow we seem to be separating this out and not perhaps, really looking at that at alcohol as being the significant, the most harmful drug that we have in Ireland. It's the most widely available, it's the most widely used, and it is the one that carries the most harm here in Ireland.
So are you saying, Sheila, that more people in Ireland have a alcohol use disorder than would be, for example, addicted to cocaine or cannabis?
Oh yes, but absolutely by miles. Like it's an order of magnitude bigger. There's no question about that. It is much bigger indeed.
Okay. We've discussed this issue before, Sheila, but yourselves in Alcohol Action Ireland believe that there should be an Office of Alcohol Harm Reduction, don't you? Because if there was, that would tie in well with the new national drug strategy if alcohol was more focused on, wouldn't it?
So yes, in connection with an alcohol office, the reason we would be focusing on that is that we would say that issues around alcohol go across multiple different departments in government. So you have the Department of Health, which is, if you like, picking up the pieces from health issues that arise from alcohol. But then you have other departments, like the Department of Finance, which sets the rates for excise duties. And we know that actually a very powerful thing that can actually reduce alcohol consumption is to increase the price, on which that can be done through excise duties. But there has been no increase in excise duties in the last 12 years. So we would be saying there's a need for a coherent strategy right across government, that could tie these different elements of, for example, pricing, but also things like the licensing of alcohol. So right now, the licensing of the sale of alcohol would fall within the Department of Justice. And that doesn't always necessarily link up with, the health concerns that would arise from the sale of alcohol. So we would say there is a case for a central office that would try and coordinate alcohol policy across multiple different departments.
Okay, Sheila, just before you go, do you have any indication that alcohol, like the next national drug strategy, there will be a change as regards alcohol?
Well, we know that alcohol will be included within that. And, the strategy has been drawn up at the moment, and, we're really just encouraging the department to really look at those elements around alcohol. And in particular, we're also calling for not only increase services for those harmed by alcohol, these services should be trauma informed, but we're also saying, that specific groups of children, for example, who are both possibly affected by FASD, fetal alcohol spectrum disorder, and indeed the children who are growing up with alcohol harm in the home and the trauma that's caused there, that there's a need for very specific services for those people as well. So we would certainly hope to see that in the new strategy as it's been developed.